Well, hello, everybody, and welcome to CE Elevated. This is a CSU Vet CE webinar series. I'm Ross Palmer from Colorado State University, and I'd like to thank you for joining us on behalf of CSU Vet CE here at the Translational Medicine Institute, better known as the TMI. We've named this particular webinar series CE Elevated, and that's symbolic of our mountainous Colorado terrain, as well as our mission to provide you with elevated CE experiences just in everything that we do. We're sincerely thankful for the support of MAI Animal Health this evening, who has made this webinar episode possible. So tonight we're joined by Dr. Naomi Hoyer, and Dr. Hoyer is not only a good friend of mine and colleague, but she's a board-certified dentist. She's an assistant professor of dentistry and oral surgery and the dentistry service leader at Colorado State University's Veterinary Teaching Hospital. She graduated from CSU with her DVM in 2002 and worked in general practice for 10 years before pursuing general practice training in dentistry. I think those years in practice and that transition to specialty training is going to come full circle for us this evening. She earned her board certification in 2017. She left private practice in 2018 to pursue her passion for teaching veterinary dentistry, as we'll see this evening. Her other professional interests include congenital maxillofacial defects and regional anesthesia. And when she's not admiring teeth, she is spending time with her family. She's running, hiking, reading, and knitting. So today, what Naomi will be sharing with us is her experiences introducing comprehensive dentistry into general practice settings such as yours, and how to work through the challenges and the pitfalls. And if during this presentation you find yourself wanting to learn more, I'm happy to say Dr. Hoyer will soon be leading 3 different hands-on dentistry training courses here at the CSU Vet CE Training Center. And the first is a small animal dentistry for the general practitioner course on March 3rd and 4th. And it's followed by canine dental extractions intensive on March 5th, and then feline dental extractions intensive on March 6th. So a lot of great opportunities there. One of the kind of cool deals is that you get an instructor curated dental instrument set included with your course registration to kind of help get you on your way. And so that's probably worth checking out if you're into the hands-on training experience. But now, without any further delay, I want to turn the session over to Dr. Hoyer. Welcome, Dr. Hoyer.
Thank you so much, Dr. Palmer. I really appreciate it. As Ross mentioned, my name is Naomi Hoyer, and I am thrilled to be here with you this evening. This presentation that I'm going to give tonight really comes out of questions that I have gotten from people who have taken continuing education that are really excited to take these experiences back into practice, but sort of are struggling with knowing exactly where to start. Because it's one thing if you as a doctor go and do a CE, you're excited about, you come back into the practice, and then all of a sudden you run into the reality that practicing dentistry in a practice really needs to be a practice-wide sort of attitude about the dentistry. And so I really like to talk about kind of the places where the whole practice itself needs to kind of shift their thinking to be able to make dentistry really successful. I'm not a huge fan of reading learning objectives, but I do like to just kind of revisit them at the beginning of every talk so that everybody can make sure that they understand what we're going to be talking about. And then more importantly, if you feel like we've gotten to the end of the talk and I haven't talked about any of these things, please give me a call and let me know. So what does comprehensive dentistry even mean? So again, it's one thing to go to a continuing education course and learn how to be the best tooth extractor in the whole world, or to become very efficient at local blocks, get really, really good at taking dental radiographs. But there's a lot before the dental procedure itself, and then after the dental procedure, that are really important when we're thinking about these concepts. I love this picture. This is actually a picture of a kitty cat. We have been consulting with the owner today. So this is a kitten who has retained deciduous teeth. You don't see that as much as you see the adult animals with retained deciduous teeth, especially those little dogs. But I feel like this kitten encompasses sort of everything that I like to talk about with comprehensive dentistry. So this kitten has a problem that the owner noticed. So it's a really easy situation when we can talk about addressing client concerns. Intraoperatively, this is a kitten who we're going to want to make sure that this owner understands the benefit of what we do, because most people don't think of young animals in dentistry. And then postoperatively, we've gotten this kitten at my favorite time of life to actually talk about preventative dental care, which is when the animals are young. As much as I love taking out teeth and doing big surgeries on dogs, man, if we could see every patient as an 8-week-old, which is something that I don't have the ability to do anymore, but is absolutely in your wheelhouse as a general practitioner, we can make so much difference for trying to help these animals keep their teeth in the long run. So we're going to start going through these items, sort of the preoperative period, the intraoperative period, and then the postoperative period, one at a time. And the first thing that I like to talk about when I talk about the preoperative period is addressing client concerns, because a couple of things. Most of our dentistry patients, as we all know, don't actually come in complaining about dental disease. If the owners have noticed a problem with the teeth, it's probably pretty bad. Most of the dental disease that we're going to see is going to be on an annual exam. We're going to lift the lip of a patient who is getting an annual exam, and we're going to notice some dental pathology that the patient hasn't been complaining about, because dogs and cats are much tougher than we are. And the owner hasn't looked because most people aren't very good about providing preventative care at home. And client concerns fall into what I consider 3 big categories. So if you're with, and my random client whose name I always use is Mrs. Johnson, so I apologize if your last name is Johnson. It's not in any way meant to be offensive, but if you are Mrs. Johnson and you've brought your dog in for what you think is an annual exam and vaccines, and your veterinarian looks in the patient's mouth and has identified signs of periodontal disease or a broken tooth, and so you go down this very, very different pathway, Mrs. Johnson is going to have a couple of concerns. One, how much is this going to cost, right? We've all gotten that question more times than we care to ask. And we'll talk in a little bit about making good estimates. The next area of concern that Mrs. Johnson is going to have is anesthetic risk. Mrs. Johnson is going to tell you the story about her dog that she had who died under anesthesia several years ago, or she had a family pet who died. And so one of the things that I really, really encourage people to think about is being really honest about addressing and assessing anesthetic risk. So I never, ever, ever tell a client, I know for sure that your pet is going to be okay when I anesthetize it. Instead, what I say is, I am going to do the very best that I can to decrease all the risks associated with anesthesia. And then I'm going to list all those things that we do. Having a dedicated veterinary technician monitoring anesthesia, investing in good anesthetic monitoring equipment. Because one of the things that you're doing when you're talking about that anesthetic risk is also addressing that financial risk. Because one of the things that used to really bother me in general practice is I would give a client an estimate and then they would come back with, well, I can get this done for $100 down the road. I want to show that client the value of what I am doing. And then the final category of risk that Mrs. Johnson is going to want to talk to you about is procedural risks. What could go wrong with this? What happens if everything doesn't go like it should? So risks associated with procedures, dehiscence. I mean, in some situations, we do talk about jaw fractures. We actually have owners sign. I don't know if any of you have had surgery recently, but you go to the hospital to have surgery and you have like a full page of procedural risks that you have to acknowledge that you've heard about. You should have something like that for dentistry. Procedural risks associated with dental procedures don't tend to be super, super huge, but they're there, and clients are going to appreciate an honest discussion about that. Making estimates. Whew, man, this is one of the hardest parts of dentistry, because dentistry is what I like to call the black box. Like, we really don't know what we're getting into until we get that patient under anesthesia and get our dental radiographs. But if you get good at doing a conscious oral exam, and that's something that we talk a lot about when we talk about our courses, you are going to find these little tiny little hints that are going to help you put these patients in a box of, this is a true preventative dental procedure where I'm anticipating cleaning and x-rays and a good oral exam, or this is a dental procedure that really needs to go into the box of surgery. So those are kind of the two big boxes that I'm going to divide things into. Create an estimate structure that allows for surprises, because even if you do the best oral exam in the world and number one, you have a patient who won't let you look in his mouth, or you have a pathology that you just cannot see until a patient is anesthetized, you're going to want to have a little bit of room. So on our ranges, we always have a spread, low end of the estimate, high end of the estimate. This is what I'm going to estimate thinking based on what I'm seeing. This is some wiggle room, and sometimes you'll get kind of burned by that. So you'll have people that don't schedule a procedure because they don't like that high range of the estimate, but so much better to have that information before you have put your resources into that dental procedure. And then make sure that the owner, more than one owner if necessary, because right, we've all had that situation where Mrs. Johnson agrees to the estimate, drops off the patient in the morning, and then Mr. Johnson picks up the patient in the afternoon, or whoever the other owner is, maybe it's a kid and a parent, and is really unhappy about the estimate. So make sure that every person who's going to be involved in those financial decisions knows about that, and have a way to make sure that they have acknowledged that estimate. So make sure it's signed, make sure it's initialed, something so that we make sure that they are getting that information. One other comment about making estimates for dentistry. I like to encourage people to avoid charging by a tooth. Because I don't know if this has ever happened to you, but there are some days on a really good day where extractions, and I like to use the maxillary third incisor as my example of this, that a maxillary third incisor on a good day, it may take me 15 minutes to get out. But if it's a big dog and there's a lot of ankylosis and that tooth has really, really been in there a long time broken, I'm going to have to make a giant flap. I'm going to have to remove a lot of bone, and it's going to take me some time to get that surgical site closed. So if you're charging all incisors as the same, then you're going to be losing money on those. So think about that a little bit differently. Scheduling procedures. This is another place that people get really stuck in this pitfall. How are we scheduling our dental procedures? Are you scheduling dental procedures so that you are trying to squeeze them in between appointments? Or are you scheduling dental procedures like they're a surgery? How do you make this happen? Number one, we want to make sure that we're using our well-trained technicians to make this an efficient process. So if you're doing dentistry in practice, one of the best things that you can do is have technicians that are trained, know how to take x-rays, know how to clean, know how to do good oral exams. You can be doing something else during that period of time, but then you need to be coming in to do those extractions. I also prefer to have a doctor double checking the technician's oral exam just to make sure, because you're the one ultimately who's going to wake that patient up. If you look at those x-rays and discover that there's something that you really wished you had seen on the oral exam, unfortunately, that's your phone call to make to the owner. The other thing, do not have the same technician monitoring anesthesia and cleaning and radiographing the teeth. It's really hard to do both well. And so one of those things isn't going to be done as well as they should be. Make sure that the doctor looks at the x-rays before you wake the patient up. I've had several situations where I have practices call with x-rays that were taken, the patient got woken up, they sent to me, and then I can tell them like, oh, this is a situation where I really would have taken out, XYZ teeth, and then they have to call the owner back for a second procedure. So make sure that those radiographs are getting interpreted while the patients are still anesthetized. All of this, I really, really, really like to make sure that this happens in the exam room with the client, all these pre-procedural things, because owners go through what I refer to as the 5 stages of tooth grieving every single time that you tell them that a tooth needs to come out, because people are very attached to their own teeth and they anthropomorphize that onto their own pets. So they're going to be very attached to their own pet's teeth as well. I call it the pearl clutching moment. So it happens in an exam room very regularly. Mrs. Johnson, and again, I'm only using Mrs. Johnson because very often it's the Mrs. of the family that I am seeing when I'm evaluating patients for the first time. Owner says, I didn't realize there was a problem with the teeth. I lift the lip and show them the tooth that has a really significant gingival recession. And I say, ooh, you know what I'm seeing here is pretty advanced periodontal disease. I think we might need to talk about extracting this tooth. Pearls are clutched, gasping happens. Number one, the first question I always get is, how will my patient eat? And what I say every single time a person asks me that is better. Even though you didn't notice that your patient wasn't eating well, when I take out this dead infected tooth, they're going to eat better. So we get through that. Then we talk about the finances because that's always concern. And then we talk about the post-procedural risk. But if they think they're bringing their pet in for an anesthetized cleaning, you have to call them on the phone while they're away from their pet, while they're already feeling very anxious about the anesthesia itself. Then all of a sudden, you're trying to pull one over on them. They're going to leave you this negative review on Yelp that says something like, I brought my dog in just for a cleaning, and all of a sudden, Dr. So-and-so wanted to take out all of these teeth. I think they're just trying to get my money. Meanwhile, no one, of course, knows how not fun it is to take out teeth that don't need to be removed. So making sure that those conversations happen in the room is really, really important. This is a great example. This is a picture of a dog who was here to have an oral mass evaluated with us a couple of years ago. This is one of our residents who has since moved on, and she was explaining all of these things, having this long, involved conversation with the owner. The dog sat there and watched her the entire time. It was so precious. So what are the pitfalls of this? Whew, we all know it. It's time. We do not have enough time as doctors ourselves to have all of these conversations that take a really long time, especially with some of those clients who have a lot of anxiety about anesthetized procedures. How do we get around it? Utilize your support staff. This is why it is so beneficial to have everybody in your practice have good education about dentistry so that they can all answer the same questions in the same way, and that you don't have to do all of the heavy lifting on this all by yourself. Because if you're trying to do all of the dentistry work, if you're trying to be the only dental cheerleader at your practice, you are going to burn yourself out on it really, really quickly. So we're going to take a moment here just to check in and see if we have any questions before we barge on to the next thing.
Yeah, I think that was fantastic. And one of the questions that had come up, I think you've done a nice job of addressing, and that was, you identify this pathology that, as you expressed nicely, the owner is totally unaware that it's there. And so it's a bit like a cold call, isn't it? You're having to not only break the bad news, and you're hitting them cold with that, but then you're having to transition that into kind of sharing the value. I mean, do you have any little tips or tricks as to what that transition is like? Best ways to talk about the benefit to the patient? Is there anything you can add to? You've very eloquently stated much of it already, but can you add anything to that?
Well, I would say I have a pretty pat answer to that because it's a question, not so much, I have the luxury now of all my patients come pre-diagnosed with disease. But when I was in general practice, I'd say it was a conversation that I had with people 5 to 10 times a day. And the conversation goes something like this. But doctor, my pet's eating fine. Everything is going fine. Why would I spend money doing dentistry on my pet? And my answer is a little bit like, here's the thing. There is no evolutionary benefit for your dog to sit at home holding their paw over their face if they have a toothache. Have you ever had a toothache? And so I like to relate it to owners. Have you ever had pain in your tooth? And immediately people who have experienced that are like, oh yeah, yes, I have. It was one of the most debilitating thing I've experienced. See, all of the pain pathways in dogs are the same. All of the pain that they experience is the same. They are just much tougher than we are. And so if we have identified an oral disease that is causing pain, that's how I like to relate it to the owners. It's a little trickier if it's periodontal disease, because unlike a broken tooth, which has an infection, we know that periodontal disease, where you have gum recession, is actually not very painful. We know that's true in people, but periodontal disease is essentially a chronic infection inside the dog's body. And so that's kind of how I talk to the people about that. Say, I know that your dog is not complaining about this disease, But periodontal disease is it's my Harry Potter ringtone. Periodontal disease is sort of this insidious chronic inflammation. And what I share with people, if it's early periodontal disease, which tends not to be as alarming for people because they can't smell the dog yet, right? You get those dogs that have terrible perio and you can diagnose them on what I call the smell test when you walk into the exam room. But early periodontal disease is a little more insidious. So I like to really focus on it as a preventative measure. Like, I am seeing this really early disease in your dog. And then I have a lot of educational material. So I have skulls and I have models and I have pictures of things. We know that this disease progresses. We know that this is going to get worse. So we are at a stage right now that if we want to save teeth, this is when we need to intervene. And I think the focus on it as a preventative tool is part of the language that people understand, because they're there for preventative medicine. They're there for their annual exam and vaccines, which is prevention. So talking to them about dentistry as prevention too can be really beneficial.
That's wonderful. Thanks. And just encourage folks, if you do have any questions as Dr. Hoyer's speaking, do feel free to type them into the Q&A window, and then we'll do our best to collate those and get those at our next pause for questions. So thank you, Naomi.
You're welcome. Okay, so forging onward. So let's talk about that next. We've talked about pre-procedural things, what we need to talk about with clients when they're there in the exam room, how we need to put estimates together, and then how we need to talk about those estimates with owners, and how we can make our lives a little bit easier as the doctor by involving other support staff in that. So now we have a patient who the owner has agreed to allow us to do a dental procedure. We're going to talk about what the procedure itself looks like. What is a complete dental procedure? And I want to start off with a couple of different caveats. I'm going to share with you the way that we do it, including the order, what we call the order of events, how things happen during a dental procedure. There are a lot of right ways to do this. I'm not saying that our way is the only right way. It's just a way that works for us. Find the way that works for your practice. So if you want to mix up the order of things a little bit, it's okay to do that. But I want you to do it the same way every time, because if you try to mix it up every single time you do a procedure, something is going to get missed, and that can be a problem. And then the other thing is do a lot of documentation, because dentistry is expensive. People want to understand the value. And one of the things that you're going to be able to do to help them understand the value that's more beneficial than anything else is taking before and after pictures. And we're going to talk a little bit about that later. So this is what we do. Every single dentistry patient, and this is actually the same thing that I did when I was in general practice. So this is not unique to being at a university. So very first thing I did when I got a patient under anesthesia is take pre-pictures. So pictures of all of the dental arcades, all of the teeth, and then anything interesting in the oral cavity. Is there a mass that I didn't know was there? Is there an area of ulcerated gingiva? All of those are really useful for the patient record. Next, we take our x-rays. Now, this is a step that you'll talk to some veterinary dentists who believe very strongly that the x-rays should be done after the cleaning. I actually don't like to do it after the cleaning. I want to have the x-rays right away for a couple of reasons. One, when you first get your patient anesthetized, the anesthesia plane is actually going to be pretty light. And if you start cleaning right away, you might notice that your patients are waking up, and then you're needing to turn your gas up and up and up and up. So then by the time you get to something a little bit less stimulating, like x-rays, you may have a problem with your patient's blood pressure going down and down and down. Whereas if we start with something that really isn't very stimulating at all, like taking x-rays, our anesthesia folks are much happier about being able to get that patient at a good plane of anesthesia. After we take our x-rays, the next thing that we do is we clean some teeth. We like to get a little bit of that calculus off so that when we're doing the oral exam, we can see the surfaces of the teeth. Now, we're not going to go, so if it's obvious that a tooth is coming out, we're not going to go crazy cleaning that tooth. And there may be some teeth that we have to come back and do a little bit of spot cleaning on, but we're getting a lot of the big calculus and plaque off at that point. The other thing that taking x-rays first helps us do is that really helps us see. So if I can see on x-rays like, oop, that one's going, that one's going, that one's going, I will come right when that patient's anesthetized. I'll look at all those x-rays as they're being taken. I make sure I've gotten all the views that I want, and then I can walk away and do something else while the technicians, and in my case, the students are working on the cleaning. Then we do a full oral exam. We get out our probe, our Explorer, and we have a dental chart. We write it all down. Formulate a treatment plan, because now we've gotten both our x-rays and our oral exam, and then we call the owner. Place any blocks, perform any treatments, usually extractions. Lots of times we do other things too. And then we take post-op x-rays, which we do on every single patient every single time, and post-op photos, which we'll show you in a little bit what we do with those. Picture worth 1,000 words. So this is a typical cute little dentistry patient. Like, you know, the breath is pretty bad. Like, look at these pictures. We can all imagine what that patient smells like coming in. And you can see that in this more rostral part of the oral cavity, we have some teeth that don't look too terrible. These are really the teeth that owners can see in the oral cavity. The vast majority of owners have no idea how many teeth dogs have further back in their mouth. So having a good set of pictures of just exactly how horrific the disease was all the way back there, all of a sudden that owner is going to understand on a whole different level exactly what you've been doing for those 2 hours that you had their patient under anesthesia. X-rays, full mouth x-rays on every single patient, every single time, no exceptions. This is just one of those things when you're doing good dentistry that you do well every time. On this patient, this is the same patient as before. We can see we have a variety of degrees of periodontal disease, but I think it's safe to say it's bad all the way around. If you're at that place in your practice where you're either introducing dental x-rays or you've just gotten them and now you're at that place where you're trying to figure out exactly how to use them well, I just want to give you a couple quick notes. Have someone come and provide some in-clinic education for you. There is nothing more sad than when I see people who have invested the money in getting a dental radiograph unit and then it is turned into a glorified lead apron or coat hanger because they just don't have enough people who are well trained to do it. The doctors get the perception. Doctors have this phenomenon that I like to call the N of 1. So you went to a dental CE, you got a dental x-ray unit because you were really excited about it. You got really jazzed up. You maybe did a little bit of training with one technician, you got a patient under anesthesia, and then that technician proceeded to take like 2 hours to get dental x-rays. And you were like, okay, that was terrible. We're never doing that again. Don't let this be a time where you use that N of 1 rule. Make sure that your techs are getting education. And it's really easier if somebody comes into the practice for you. So that can be a really, really beneficial thing. Find somebody to help you with interpretation. So again, when you go to CE, you learn that, but then I like to encourage people to find kind of a dental buddy, like get some good books so that you're really knowing your normal. But then if you have x-rays that you're getting that you just don't know what you're thinking, figure out somebody like me, like a dentist near you who can help you interpret them. Expect it to be slow. So don't give your technicians who are learning how to take x-rays a hard time if they have a learning curve. Provide them with a cadaver head. I know it sounds gross and some technicians will really fight you on that, but there's much, much better use for anesthetic time than having 2 hours to take dental x-rays. In general, I tell people that you should take about 10 to 15 minutes for a cat and maybe about 15 to 20 minutes for a dog to get a full mouth set of x-rays. Offer full mouth x-rays at a competitive price, but do them with every single dental procedure. You will more than pay for them. And I don't even offer it as an option, even when I was in general practice. You didn't want to do the x-rays, we just didn't do the dental procedure. The more often you do them, the faster your techs will get, the better you'll get at reading them, and the more pathology you will find. Just a quick word about dental charting. When I was first out of veterinary school, which was many, many years ago, my daughters refer to it as olden times. This is what my dental charts look like. This was a little sticker that I stuck in my paper records, and I maybe circled some things or maybe X'd some things, maybe colored in some things, and that was the extent of my dental charting. This is a dental chart more similar to a dental chart that I use now. You'll notice that it has a spot for every single tooth for all of the parameters that we need to measure. So gingivitis, gum recession, furcation exposure, mobility, probing depth, and then x-ray findings. Every single tooth in the mouth needs to be examined to that extent. This dental chart is actually only the first page. So on the second page, so this, you'll notice this says examination. On the second page is the procedure chart. What does a complete dental cleaning look like? Many, many practices just use this, which is your ultrasonic scaler. You actually, on every single patient, should also be using hand instruments, hand scalers, and hand curettes. This is a great skill to get some teaching on before you try to do it, because you can damage if you use the wrong equipment for the wrong thing. But there are spots on many teeth that you shouldn't be using your ultrasonic scaler for, because you would have to use the tip, which is not an appropriate use of equipment. And there are spots between the teeth that you should be using ultrasonic scalers or hand curettes. Really, really important to be doing your ultrasonic scaling first to get the majority of the disease causing plaque and calculus, and then go back with your hand instruments. Really important stuff. So I get a lot of questions about the when do I need to ask permission? So you'll notice that it says on my order of events that for every single patient I call once we have gotten our oral exam, and I do that. And this is, you'll see written here, 3 choices that we had when I was in general practice on our release forms that we offered owners when we were talking about extractions that would need to occur. I prefer that you proceed with all necessary dental procedures. I prefer to be called first, but then I want you to go ahead. Or if I can't be reached by phone, I want you to wake my patient up. I started, even with people who checked this box, what I noticed was if we had an extraction that we found that we weren't anticipating, I would do that extraction. This person that morning that they dropped off had happily checked this box. I happily did my extractions. I called postoperatively to tell them that I had taken out a tooth, and they were mad at me, even though they had clearly checked this box. So now I call every single patient once we have our oral exam done, and we say, you know what, turns out that just like we suspected from our oral exam, we have an extraction, or turns out we thought we had 1, but it turns out we had 3. And what that allows that owner to do is help you feel like they're part of the process, part of the decision-making process. And so you can talk that through before the teeth are in a pile on the counter. The other question I have is, if you have a patient who is not stable under anesthesia, wake that patient up. You can call the owner once the patient is not stable. If your patient is so unstable that you can't take 5 minutes and call an owner, then we need to not be doing this procedure today. After photos, so important. So this is our cute little Westie. These are all, I think we took out like 27 teeth on this dog. These are all his after photos. Love it. The owner's going to be so excited to be able to see what was going on. And this is what we do with all that. So this is something that we provide for our patients who have been in to see us at the teaching hospital. We get a cute copy of a picture of the patient, either from the owner or we take one. We do before pictures, we do a little summary of what happened, we do after pictures, and then we show x-rays with some kind of important highlights. Love it. People just absolutely love it because it helps them understand exactly what went on when their patient was there. So now we're going to take another little pause. We've gotten to the end of the dental procedure itself, and I want to make sure we don't have any questions.
So you did a really nice job of talking about the insistence on, I want full mouth radiographs, and that's just your policy. I think any of us who have been in practice, we know that what you want is not always going to be uniformly adopted. So how do you handle the clients that were resistant to adhering to that requirement for full mouth radiographs?
That is a great question. And I think a couple of things. One, if you have, so part of it is about creating your practice culture around dentistry. So are you trying to create a practice culture where your whole practice does the same thing and practice has made the decision to practice this kind of comprehensive dentistry? Because if you have, and this is the beginning, you are going to get a lot of pushback. I like to compare it to, again, back in olden times when I was a more recent graduate and I worked at a practice where we made the decision that we were going to place IV catheters for every anesthetized surgery that we did, because that used to be something that owners could choose. They could choose an IV catheter with fluids, or they could choose to not do it. And at some point we decided, you know what, as a practice, this is important to us that we, as the doctors, be making the medical decisions. And for me, doing full mouth x-rays on dentistry patients is the same thing. So if your practice is at that point where you are going to say, you know what, dentistry is important. I understand its value as preventative medicine. I understand how much benefit we create for patients when we take care of severe dental disease. We are going to do good dentistry. Now, are you going to have patients who then aren't going to do dentistry with you because you won't budge on that? For sure. But if you have a practice that's doing a good job of educating clients about how important it is, it's going to be fewer people than you think. Where you're going to run into trouble. So this is an experience that I had when I worked at a practice as a general practitioner where I didn't have practice buy-in. So I was like the only, I like to say, the pitchfork carrying person who is interested in dentistry at the practice. So I would spend a tremendous amount of time in the room educating clients about dentistry. I would give them the estimates. I would feel like, yeah, they're going to go out and schedule. I would walk them up to the reception desk. I would walk away, and then the people never scheduled the dental procedure. And I couldn't figure out why until one day I stood there at the edge of the reception desk without them being able to see me. And I listened. And what I discovered was that the receptionist, every single time she saw the estimates, was saying, oh gosh, that seems like a lot of money. So making sure that you have buy-in from everybody is really important when you start to make that shift.
I think that's a great comment for sure. Presumably these, thus far, we're talking about all anesthetized dentistry. Is age a factor? Like, how do you decide when you're going to start to do anesthetized dentistry? Is there an age factor, or is it independent of that?
So I would say, I think it's totally independent. So is there an age factor? Yes. What is the age? Like 1 to 2. I think that is another thing that has really changed over the course of my career in veterinary medicine, is that we used to think of dentistry as a disease of old dogs and cats. And that is true if you are just trying to play catch up. But if you are including dentistry as what should be, in my opinion, included in the really critical preventative medicine that you provide at your hospital, like heartworm prevention, like vaccines, you are starting that at the time when they are puppies and kittens. And we'll talk about that a little bit more when we're talking about our post-operative, but prevention starts with puppies and kittens because that's really the only time where we can get the owners training their pets to have good at-home dental care. And then their first anesthetized procedure, as long as we're not seeing any pathology, man, I would say by 2 at the latest. And if it's a Yorkie, I'm serious when I say that it's at 1. Like, if we really want to be preventative about it, the younger we're doing it, the better.
Cool. Well, thank you very much. Looks like that's all the questions for right now, and we'll check back, I'm sure.
Okay. So preoperative, in the procedure, now we're going to talk about what is the client's role. This feels like a lot, Dr. Hoyer, that you're telling me that me and my practice has to do in order to provide good dentistry care to your patients. And you know what? You are absolutely right. Getting the owner involved in preventative medicine, really, really, really critical. Owners have to do a lot for preventative medicine already. We ask them to administer antiparasitics at home. We ask them to bring in their patients for their vaccinations. We ask them to have dogs groomed if it's appropriate. Dentistry is a really big part of it. And the biggest part of it is home care. Like, what can patients be getting done at home? And the most important thing that they can be getting done is learning to have their teeth brushed. And I know it sounds silly, but it's really important. You will have no better dental advocate for your patient than a client who really brushes their dog's teeth, for many reasons, not just because of prevention of periodontal disease, but these are the clients who are going to notice tumors that are small enough to do something about before they've gotten so big that they've taken over the whole dog's maxilla. This is a client who's going to notice when they get in to brush their dog's teeth that, oh my gosh, my dog always is really good about having his toothbrush, and then he's been really resistant, and I noticed that he'd broken his upper 4th premolar before the dog shows up with a giant abscess. This is a cat owner who, they can't brush, because let's be honest, cats and brushing, right? It's a little iffy. Even if they can just only look, what they're going to notice is, oh my gosh, my cat has always had really, really nice pale pink gums. Now all of a sudden I'm seeing this one tooth, it's really, really bright red bleeding gums, which is the first sign of tooth resorption. So getting owners set up on home care, so critically important. Brushing really is best. That is the best thing that we can do to prevent, especially periodontal disease in our companion animal patients. But there's all kinds of things they can do if they can't brush. So I do actually have patients who have their own water picks. So the dogs get their teeth water picked. I don't have a cat who has a water pick, but I certainly have dogs. I very much insist that owners do not share their water picks. And I unfortunately have had to specifically spell that out for people, which is always a little gross. You know, I tell people that I am constantly amazed by how the lengths to which people will go. So what you're seeing down on this bottom part of the screen are these little, I call them Christmas tree toothbrushes. They sell them for people with braces to get like in between the little brackets. I actually have owners who have dogs that have a little bit of furcation exposure, but they really, really wanted to try to save the tooth, who will brush their dog's furcation with those little Christmas tree toothbrushes. So don't underestimate the power of a well-educated owner. One of the things that I used to do when I was in general practice is that I would do these amazing, amazing dental cleanings on dogs. I would send them home with the cleanest mouth in the whole world. And the owners would come back in about 3 months mad at me because the dog had plaque and calculus accumulating again, because I had not communicated how important it was for them to do home care. This is something that I like to tell people all the time. It does not matter how well you do with dental cleaning if you're not educating them to do something at home. So if that one day out of the year, they're getting great dental care and 364 days they're getting none, might be fine if it's a lab, right? Because they don't tend to get as much periodontal disease. But if it's a Yorkie, you are 100% not going to be fine. And then just to Dr. Palmer's point, when should this start? This should start when they're puppies. So this is a cute little puppy that I saw when I was in general practice, just as cute and fluffy as can be. And this is my old wonderful heart dog before she passed away. She was at this point 7. Like, this is too old to be introducing home care. This is when we want to introduce home care. Just like we are seeing puppies, you're talking to owners about nail trimming and checking ears and coat care and all of those things that we're doing in puppies. Get something ready to send home with them. Might look a little bit like this to talk about home care. So this should be tailored to every patient, because, you know, if you have a dog who at 1 came in for the first dental procedure and you're talking to them about home care and you're sending home chews that the patient can't have, probably not a great idea. So we have just sort of a general handout for people. We have some samples. We give them the VOHC website, which is the Veterinary Oral Health Council, which has lots of great recommended products. And also think about what the owners are capable of. We have some owners who tell us, you know what, like, I work a super busy job. I am not going to brush my dog's teeth. What are my other options? If I have come in on my high horse and said brushing is the only thing that we can do, everything else is terrible, probably haven't made a great connection with that person. I'm going to ask them, be like, you know what, brushing is best, but here's some other things. Sort of the next good thing. So brushing is best. Anything that physically removes plaque and calculus. So treats and chews, but I don't want it to damage teeth. So I'm going to make sure that I'm not telling you to have treats and chews like antlers, nylobones, anything that's going to really hurt if you get it flung at your kneecap is something that you probably want to avoid. You'll also hear people talk about the thumbnail rule. If you can't indent the chew toy with your thumbnail, it's probably not something you want in the dog's mouth. Patient size. My favorite story about this is I once did a number of extractions on a Chihuahua. And one of the dental chews and treats that I like to send home is TD, the food, not so much to replace as a diet, but to actually use as like a treat, because those big chunkin' things are really good for little dogs to bite into, also much less fat than some of the treats that owners are using. So I had this long conversation with this owner about his Chihuahua and how great these would be as treats. And I gave him one, and that dog went and swallowed that thing whole. I thought it was going to have to reach down into his esophagus and grab it out. So keep in mind that when you're recommending chews for dogs, make sure it's a dog who's actually going to chew. And then write stuff down. When people are taking home their pet after an anesthetized procedure, they are not thinking about brushing their teeth. If we're doing this as a part of an appointment, I send them home with a handout with some samples. If we're doing this after a procedure, I actually like to do it at the recheck and not when they're taking their patient home. They are flooded with so much emotion when they're getting home their patient after a dental procedure. That's in general not the right time to talk about home care. So in conclusion, this is another one of my just most adorable dental patients. I love him. You can't really tell, but he's these long black whiskers, so he looks like a little walrus. Oh my gosh, he's so cute. All of our patients deserve to have complete veterinary care. I mean, dental care, veterinary care too. Some of the people that you recommend this to are not going to listen, and it's okay. like you're not going to convert everyone, but even if you convert half of the people in your practice into doing good veterinary care, first of all, you're going to do more dentistry than you know what to do with. Second of all, you're going to be providing good preventative care to so many patients. Involve your whole staff. This cannot just be on you as a doctor. Make sure that everybody has a role. Technicians can be talking about home care. They can be talking about rechecks. They can be going over estimates. Front staff can certainly be talking about estimates. Owners often have a bond with good front staff that they don't even have with the doctors because they feel like they're not getting judged by that group of people. They can ask questions of those people that they're not going to ask of you. So make sure those people are advocating for pets in the same way. And involve the owners in the home care. If you don't, you're just going to run the risk that those owners are going to come back and be like, well, I did everything you said. We cleaned the teeth. And now 2 months later, I'm seeing plaque and calculus again. And then, of course, it's going to be your fault. So we're going to take this last moment to take any additional questions. If you haven't noticed, I love a little good dental humor. So that's another one of my funny dental jokes.
Thanks, Naomi. You've talked a lot about really sort of transforming the practice culture and engaging your team so that they're part of developing this comprehensive dental practice within the practice. Are there ways that you can help the support staff, basically help support your support staff? How do you engage them in this? Are there ways you think can promote engagement of your staff so that you're not having to convince them, but they feel part of the team and they actually have buy-in from the get-go? What are your thoughts on that?
So I would say I feel like the buy-in is much easier to get with technicians because they see the procedures. I think one thing that's actually really beneficial is to have your front staff see the procedures too, because I think a lot of times we expect our receptionists and our client support representatives to be able to answer questions intelligently of clients of procedures that they maybe have never seen. So having them understand what goes into a dental procedure, what is it that we're seeing in these patients' mouths when we're getting them under anesthesia? What does it look like to get x-rays? So that they're really understanding. And then always, always, always education. And so there is good education for veterinary technicians about dentistry. I would urge you, if you don't have a place there, unfortunately, we don't do a great job as a profession of educating your veterinary client support representatives or your receptionists. Create some good education. Let's talk in our practice about why dentistry is important. You probably teach receptionists about what they're supposed to say about heartworm preventative. Let's teach them about what to say about dentistry. Let's talk about why it's beneficial. Let's talk about what they're hearing from clients about what clients' concerns are, not just financial, but an anesthesia, so that we can really give them the information that empowers them to answer those questions.
Yeah, I'm glad you mentioned that. What I have seen certainly is, for some of our courses, we do offer a technician tract as part of it. And it is so amazing to watch when you have a veterinarian side by side with their technician working together in their education and training. You can just see that the buy-in and just the awareness, the excitement over the topic it is just palpable. And so that's something that's really enjoyable. Here's another question is, do you have thoughts on water additives in a preventative care regimen?
Yeah, of course, I have thoughts about everything. So yes, I think water additives can be beneficial. I would say you just have to be careful that you're recommending them for the right reasons. So water additives definitely do not replace brushing, because no water additive is actually going to remove plaque and calculus off of the surface of the teeth. The situations where I have seen water additives be really beneficial is for those patients who, even when they're getting chews or they're getting brushed, they just still develop a lot of gingivitis in the face of very little plaque and calculus. And then I think water additives can be really beneficial. But I want to make sure that people understand that because people, of course, everybody, we all want the quick fix. I want something that's going to magically make me thin, where I can eat all of the Snickers that I want and I don't have to worry about exercising. Like, that would be lovely. That doesn't exist. And it's the same thing with dental disease in dogs. My clients are always like, I just want something I can put in the water that's going to prevent my patient from getting dental disease. That thing doesn't exist. But water additives can be good as long as we're using them for the right thing.
That's wonderful. So there was a lot of information in a short time for sure, but great information. And so I want to thank you, Naomi, for your presentation. We certainly appreciate your willingness to contribute to this CE Elevated webinar series and to so many of our hands-on courses. Appreciate that. Also want to thank our sponsor, MAI Animal Health, who is the sponsor for this webinar episode. And as a reminder, Dr. Hoyer will be leading 3 hands-on training courses here at CSU Vet CE in our training center within the Translational Medicine Institute. The first is a small animal dentistry for the general practitioner. That's a 2-day on March 3rd and 4th, and it's followed by intensives. And so there's a canine dental extraction intensive on March 5th and a feline dental extractions intensive on March 6th. And there's some bundle pricing on those if you're interested. Those intensive courses are a hybrid model in which you'll do much of your online didactic work in preparation for your hands-on training. So once again, I'd like to thank all of you for joining us this evening. Next month, we'll be learning about the benefits of laparoscopy and GI endoscopy and the benefits to your patients, to your clients, and to you. That episode will be presented by our own Drs. Eric Monet and Dr. David Tweet on Wednesday, February 2nd at 7 p.m. New York time. That's 5 p.m. here in the mountains. We'll look forward to seeing you then. And in the meantime, remember that you're more than a learner, you're a whole person. So take care of yourself and let's look out for each other. Thank you and have a great evening.